Today we have presentations from eBridge, which is a telehealth product that can help critical access hospitals and rural EMS work together to coordinate care and improve their operational effectiveness. It can also do so many other things that you will hear about soon. Our idea for this project is just to get something to help our rural EMS agencies and critical access hospitals just work together a little bit more, increase their communication and collaboration, and we're hoping that can lead to quality of care and care coordination.
So they're able, as that 911 call comes in, if this is a case where we have a longer response time to get to them, or we have what we feel is a very high degree of suspicion for a COVID patient, we can shoot them the link and jump on with that patient. And that allows us to pre-screen them, see what type of situation that they're in, and really limit our manpower that's actually going to go in. We were blessed with the amount of PPE that we had, but many organizations didn't have that. So that allowed us to take a skeleton crew in, if you will, to go inside and meet with the patient and limit our PPE use with that. We get an individual that's out there in the middle of nowhere land, fallen off a horse, broke a leg, done what have you. We have some unique ways of being able to find those individuals, but the chance to be able to shoot the link to them to physically see what's going on, we think could prove very beneficial. So the dispatch supervisor can actually bring the truck that's responding to the patient onto the call. So you can have multiple people on that call at the same time and pass that information, if you will, over to that responding medic on the truck, and then they can take over that and talk with the individual before they get there and get that game plan. What we found has been working fantastic. This is with trauma, this is with stroke, anything along those lines. We do a quick, it's like 3 buttons. Bring it up, do a quick video of your exam. If you use Cincinnati scale with the van or whatever you use, LAMS, you just do a quick video of that and send it in, because obviously the neurologist is not standing right there at the console at the hospital. We send it in to them, and he's able to come down, or she is able to take a look at that and then decide, based on our transport time to the hospital, if they need to do a consult. We have found that many times they don't even have to do that. Based on seeing the patient, seeing our exam, they're able to go ahead. Many of them are mixing up TPA before we get there. And they're able to go ahead and fire the cath lab up, which becomes ultra important both at night and on the weekends. You could build the forms, build a quick abbreviated run report in there that they can be filling out as they're going through the call. They send that off. You pretty much relieve that even having to call the hospital to let them know you're coming. Most of the time, you've eliminated your radio conversation with them, and you've eliminated the need to leave a abbreviated run report. So during that 7 days, we can shoot the link out to them. We have to physically watch them take the medication. So that gives us the ability to be able to do that. It also gives us the ability to build out that other side, because there's not a whole lot of affordable, I guess you would say, patient care reporting mechanisms, but we intend to utilize this as a mechanism to have that, make a conscious decision whether we need to put ourselves in harm's way to be able to respond to that shelter, or we can give them that sort of personalized medical care from us or even from the hospital. We have specific cases where the trauma patient we've extricated them, they left, they're going to the hospital. We'll do a quick video around the scene, showing the mechanism of injury, showing the patient, so the physicians can they're standing there ready to go. We've given our trauma alert, and I will tell you, from the hospital's perspective, they went absolutely bonkers over that, to be able to have that sort of information and see what environment that patient was in and those potential mechanisms of injury before they got there.